Now, in 2016, 18-year-old Oliver McGowan from Bristol died at Southmead Hospital following a seizure. He had mild autism and he had epilepsy and had been given antipsychotic medication that led to his death. Since then, his mum Paula has been campaigning for all healthcare staff to get training in autism and learning disabilities. Well, today, the government has announced that that training, named in memory of Oliver, will be made compulsory for all NHS and social care staff. We can talk to Oliver's mum, Paula McGowan, who is now based in Australia. Good morning, Paula.
Good morning.
Good morning. Can you hear me okay?
I can indeed. Can you hear me?
Fantastic. Yes, we can. First of all, how are you doing as a family, Paula?
I think as a family, we live our lives. We exist. We live with an eternal pain. We're just parents who've lost someone he was our world.
Absolutely. What do you think about the fact that your campaigning has led to this announcement today that training is going to be made compulsory for NHS and social care staff?
It's the first step forward. It's something that was vital. I had no idea that medical staff had almost zero training in autism and learning disability awareness. I had no idea. And that's why I did the campaign asking for this training. It's essential in saving lives, really. I mean, to have over 1,200 people die from preventable deaths a year purely because they've got a label attached to their being, that label being autism or learning disability, that is not okay, is there? That is far from okay. And exactly why the training is essential.
And were you able to find out why the staff were not trained in this way through the course of, the investigations that went on after Oliver's death?
No, not at all. It became apparent during Oliver's inquest when one of the questions was put to one of the medics why he didn't make reasonable adjustments. And he said he'd heard about it, but didn't really know what it was. Now, we're talking about the most reasonable of adjustments. So, not standing over a person while they're stood up, not talking in medical jargon. This is basic stuff. Now, some medics do get training, but is the training, is it of a good standard? Clearly not, because we've got well over 1,200 deaths a year. So it's not fit for purpose, is it really?
And you said this was sort of the beginning. Do you feel like more needs to be done?
Oh, goodness me, yes, absolutely. So whilst we have the training and it looks quite good, to be honest, it's the first step. Now, within that training that's been announced, there are issues with it. There are, and we need to be looking carefully at that. And we need to be keeping the pressure on NHS England and the Department of Health and Social Care to make sure that the training is fit for purpose. We do not want a tick box exercise. People with autism and learning disability, they've got a right to the same healthcare needs as everybody else. And we need to ensure that this training allows that to happen.
Absolutely. Now, a new review into Oliver's death was announced by NHS England earlier this year. Can you tell us the latest on that?
Well, that's still ongoing. I think we're very fortunate to have an independent panel looking at Oliver's death. What it's revealing is quite shocking, really, to be honest. But I'm sure that will all come out later on when it's finalised.
Yeah, we appreciate you coming on. Thank you very much indeed.
You are more than welcome.
Thank you.
Can I just say today is the day that we turned Oliver's life support machine off.
Oh my goodness.
So it's quite impactful that the training is in his name. It's his legacy. It's his life that lives on. Through helping others.
Absolutely. Thank you for coming on. We appreciate it so much. Paula McGowan there, mum of Oliver McGowan from Bristol, who died at Southmead Hospital in 2016. He had mild autism and epilepsy and had been given antipsychotic medication that led to his death. Today, the government has announced, as you heard there, all NHS and social care staff will get training on autism and learning disabilities, something Paula has been campaigning for since Oliver's